Hi, welcome back to Medicare Mondays. Today's segment is going to be all about what is new for Medicare in 2023. The first thing that you do need to know is Part A premiums. You still have a Part A premium if you did not work more than 10 years of your lifetime. If you work 10 or more years, you still get the Part A for free. Part A, if you worked between 7.5 to 10 years, your premium would be $278. And if you worked less than 7.5 years, your premium would be $506. If you don't have enough quarters and you are having a hard time paying this premium, there are full programs through the Department of Human Services in Rhode Island. You can always reach out to us and we can direct you in the best way. The Part A deductible has gone up a bit. It is $1,600 per benefit period. Now you might want to ask yourself, what is a benefit period? A benefit period is when you are first admitted into the hospital or a skilled nursing facility as an inpatient. That benefit period ends after 60 days of no going back into the hospital or out into the skilled nursing facility. The Part A hospital coinsurance is $0 for the first 60 days and then $400 day 61 through 90. You do have a lifetime reserve day. It is $800 per lifetime reserve days, and that's after day 90 of being in the hospital. Skilled nursing facility insurance is day 0 through 20 is nothing. After that, day 21 through 100, it is $200 per day. That's slightly up from last year. The Part B medical insurance, the premium for Part B went down a bit this year. It is $164.90 a month. We do have a Part B deductible, and that's for a full year, $226. After that, anything that Medicare Part A and Part B does not cover would be about 20% of any kind of bill. The prescription drug coverage, there's been a lot of changes in the prescription drug coverage. The national average is around $32. The Part B maximum deductible is $505. It could be as low as $200. Coverage gap begins when between you and your copays and what the Part D plan has paid reaches $4,660. After that, you go into the coverage gap, otherwise known as the donut hole. The catastrophic begins when you exit the donut hole and you've spent out $7,400. Couple of things that you need to know about the Part D plan is all covered vaccinations, including the shingles vaccination, will be a zero copay. And starting in January 2023, if you take a insulin that is covered by the Part D, it is capped at $35. All Part B covered insulins will start being limited at $35 in July of 2023. Extended immunosuppressant coverage may be available to you if you are eligible. One, you qualify for Part B coverage under losing your end-stage renal disease because it's been 36 months outside of your kidney transplant, or you do not have Medicaid or other health insurance that covers immunosuppressants. Couple of changes in the enrollment period for 2023. You still have an initial enrollment period, and that's 7 months. That's usually 3 months before your 65th birthday, the month of your 65th birthday, and 3 months after your 65th birthday. Beginning January 2023, the coverage will start the next month you sign up. So if you signed up in January, your Medicare Part A and Part B would start February 1st. You have a general enrollment period still. General enrollment period is January 1st to March 31st. This is a period where if you did not pick up Medicare Part A or Part B when you were first eligible and you have no special enrollment period, this is the time that you want to pick up Medicare Part A and B. Again, it will start the next month that after you applied. Special enrollment periods are considered as losing Medicaid. You're in a national disaster or emergency. You're released from incarceration. You make enrollment mistakes based on information from your employer, and you experience other exceptional circumstances. This could include a long list of things, but in order to understand those, the very first thing you should really do is contact Social Security to see when you can sign up. You can use an SEP if you lose Medicaid eligibility or whichever date is earlier and the end of COVID-19 public health emergency or on or after January 1st, 2023. The special enrollment begins when you receive a notice from the Department of Human Services in Rhode Island saying your Medicaid is being terminated. You do have a 6-month period to pick something up. You can also make sure you sit with a SHIP counselor that would be located that services your area. You can choose to have other coverage begin on the first of the following month, or you can choose that coverage to go retroactive. Remember, you will have to pay those past premiums if you choose to go retroactive. To use an SEP, contact Social Security and show your Medicaid eligibility end letter, and they will be able to help you further. Special enrollment periods during disaster or emergency, it's still a 6-month period for a special enrollment period. The coverage begins the first of the following month again. And again, you should contact Social Security because everybody should understand that the only conduit that you can do to sign up for Medicare Part A and B would be contact Social Security. There's several Social Securities in the state of Rhode Island, and the closest one to you will be able to help you. Special enrollment periods because you're released from incarceration. That special enrollment period begins the day you are released from the custody or of a penal authority. The special enrollment period ends the last day of the 12th month you are released. So that means you have a 1-year period time. You can choose to have your coverage begin on the first of the following month after you sign up, or begin up to 6 months retroactively, but not beginning before January 2023. To use this special enrollment period, please contact Social Security. Special enrollment periods because there was a mistake due to misinformation from your employer or health plan. This special enrollment period can be used by contacting Social Security or notifying Social Security of the misinformation as long as it was on or after January 1st, 2023. The special enrollment period also lasts 6 months after you notify Social Security. Coverage begins on the following month. Again, if you notified Social Security of a mistake from your health plan or employer plan, and it looks like you may have a penalty, you can tell them that you were told misinformation. They will check into it, and then they'll start you 6 months to the day you told Social Security. Please contact Social Security if you want to use this special enrollment period. Special enrollment period due to exceptional circumstances. Social Security will decide if you can use a special enrollment on a case-by-case basis. You can request to enroll through this SEP if you missed other enrollment periods because of things you could not control. Social Security finds your and if Social Security finds your situation exceptional. Exceptional means very unusual or not typical. Forgetting to enroll or not knowing that you were supposed to enroll does not count as an exceptional circumstance. Social Security decides the timing of this SEP on a case-by-case basis. Please contact the Social Security office to see if you might be eligible for one of these SEPs. They will do their background check, and then the Part A and B will probably start the month after you sign up. There's some new Medicare fraud scams. Did you know that? Did you know that beneficiaries are not receiving a new card this year? Your new card actually came out maybe in 2017, 18. So scammers may try to convince you otherwise. For example, scammers may falsely tell you that Medicare is issuing new Medicare is issuing new cards, perhaps a card that is plastic or metal or has a chip in it, or even a black and white COVID-19 cards. The scammers may tell you that in order for them to send you your card, you need to verify your personal information. Stop. Do not do it. Medicare does not call you and tell you that they need to verify your information. Here are some red flags to look for. Unsolicited calls. Anyone needing your information so they can send you updated Medicare card. Anyone saying that your card is expiring. They may need to send you a new one, or you might get a charge or a fine. Anyone stating Medicare is issuing new cards and you need to identify your number. If you need help with any of the following information, you can always contact the Rhode Island State Health Insurance Program at 1-888-884-8721. You can contact the Rhode Island Senior Medicare Patrol also at 1-888-884-8721. You can also contact Medicare, 1-800-MEDICARE. You can also request other things from Medicare when you call them, such as your Medicare and You handbook. If you have a problem with Social Security, you can contact the Social Security at 1-800-772-1213. Or you can actually contact your Medicare Advantage or Part D plan. The number would be on the back of your medical card. The following new locations for the SHIP program have been started in January 2023. We have several different partners. The first partner we have is Tri-County Community Action North. The second one is Johnston Senior Center. The third one is West Bay Community Action. The fourth one is South Kingstown Senior Center. The fifth one is Westerly Senior Center. We also have our Aging and Disability Resource Center, The Point. The seventh one is East Bay Community Action. We also have Leon Matthews Senior Center, Progresso Latino, Child and Family Services of Newport County, the Edward King House, and of course, we do have the 800 Rhode Island SHIP SMP line. We're here always to help you. Thank you for attending my online Facebook event. If you have any questions, feel free to call me or email me, or you can just review this video at www.oha.ri.gov. Stay safe and healthy, and have a great day.